All right, ready? The seizures that I was mentioning that where he would just drop to the ground, this medication completely got rid of those. But if you don't have insurance, it's $600 a month. The financial burden it has on a family is crazy because a lot of these things aren't covered by insurances. So it's really having to redesign your entire life.
Jessica Johnson hasn't worked in 5 years to provide constant care for her son Kai, who has SYNGAP, a rare genetic condition that affects development and learning. It can present epilepsy, autism, and sleep and behavior issues. Before he was diagnosed, Kai was having over 100 seizures a day. Kai also needs constant supervision and will for the rest of his life.
And the NIH funding is one of the things that we have to give us hope, because as a small population of people, as a community, we've come together and done a really good job of fundraising. Cure SYNGAP 1 does $1 million in grants a year, but that's like a drop in the bucket in comparison to what we could have with NIH by our side.
The Trump administration has made cuts to agencies like the NIH and has seen over $2 billion in frozen or canceled grants, according to the Brookings Institute. The administration also wants to cut health spending in the coming year and plans to cut the budget in the National Institutes of Health by $18 billion. Dr. Huganier researches developmental neuroscience at Johns Hopkins in Baltimore. His lab has been funded by the NIH since 1998.
And that could be, if everything goes as we hope, could be in a clinical trial within 3 to 5 years. So it's really a key time for these kids and for the families.
Right now, his lab is working on finding a cure for kids like Kai who have SYNGAP. Dr. Huganier is worried that funding cuts could impact his lab, either through layoffs or shutting it down completely.
We are currently waiting on 2 grants that are submitted to NIH and to see if they're funded, and if they're delayed or not funded with the budget cuts that might be coming in the fall, it's definitely going to impact the timeline for development of these therapies.
So a cure is my biggest hope. Therapies would be wonderful to help with some of the symptoms, but really what would be life-changing would be a cure.